Hi, I'm Jeremy LaPlante, your host today for the VORTRAN View. Today we're going to be discussing the VORTRAN Automatic Resuscitator, or other people like to call it an automatic bag. The nice thing about the automatic resuscitator is it's fully disposable, it's for patients weighing 10 kilograms and above, and can be used for 100% or 50% FiO2. These are great for mass casualty incidents, disaster preparedness, inter and intra-hospital transport, pre-hospital in the EMS for either just resuscitating in the field or transporting to the facility, hospital. I'm going to talk today about setting up the VAR and a few different things that goes on with the VAR. This device here on our VAR is called the modulator. This is what provides the percussion, or the ventilation for the device. If this wasn't here and we just had a normal resuscitation bag, and I put it here, that's all it is. We're an automatic bag. That's the best way to think of the VAR. It's an automatic bag. Anytime when you're ventilating a patient with a bag or an automatic resuscitator, you can never leave that patient unattended. You always have to monitor the patient and make sure there's consistent chest rise. And if there's changes in the patient's consistency of their chest rise, you need to make an adjustments. Now I'm going to go over those with you right now. An analogy I like to give to people when I talk about the VAR who've never used it before is if you consider the VAR like a bucket. You have a flow meter, which is like your faucet, and depending on how high you turn up your flow meter is how quickly this bucket's going to fill up. Now, to set the size of your bucket, that is determined by your peak inspiratory pressure, or your PIP, and that is set here with this rectangular dial to set your PIP rate. So when you fill up your bucket, you have your size of your bucket and it starts to spill over, that's considered your exhalation side or your respiration rate, and that is controlled through the round dial here, depending on how quickly or how slowly you want that patient to exhale. Now, a few things that you can provide with this device are CPAP, pressure cycle, and pressure support. Now I'm going to show you how to set it up on the patient. First thing you want to do is take the VAR out of the package, set it in front of you, pull out your oxygen tubing. You're going to want to hook up your oxygen tubing to the flow meter and then hook up the flow of gas to your VAR. Then I hook patient T and I turn on my flow to my desired amount. I'm starting it at 25 liters of flow, and what you want to do is to occlude the end and make sure that manometer is moving. As you can see, it is. So I want to hook it up to my patient, and my test lung here is simulating my patient. Now right now, I'm going to adjust my rate. Right now we're in pressure cycle mode. One little trick I want to show you with the VAR, when you first set up your patient on the VAR, dial your rate down into the slower mode until you see no chest rise, okay? And you see your manometer sit at the bottom. Then I want to slowly dial that out until I see the patient's chest start to rise and stop. What I've done is put that into a 1:2 average ratio, IE ratio, okay? So that's a very simple way of setting up the VAR. A couple other modes are CPAP. To provide CPAP, I want to dial my rate dial in until I watch my manometer climb to the pressure that I want to provide my patient. Right now I'm providing about 12 centimeters of water pressure to the patient on CPAP. This is also pressure support mode. If I dial this out just a little bit and get that manometer to sit down the bottom, the patient is to breathe on their own. It's going to go back to my set PIP rate. Then I just dial it out to get back to pressure cycle mode. And that's the VORTRAN Automatic Resuscitator. Thank you for joining us today for the VORTRAN View.